ISHA, Initiative on Sexual Health Awareness. Reproductive and sexual health deals with three major issues concerning adolescents' education, that are menstruation, what leads to pregnancy and how a baby is conceived, masturbation and its implications. Beginnings of periods is an important landmark of puberty in girls. Changes which start from the beginning of puberty are at reproductive maturity of the adolescent. Due to certain changes initiated by the brain, hormones are released which lead to development of the uterus and ovaries. Once they are well developed, the ovaries start to form an egg or ova. This causes the inner lining of the uterus to thicken in anticipation of the pregnancy. Once this does not occur, this lining is shed off. This is what causes the menstrual flow.
Is it very painful?
It begins as a pinkish discharge and later becomes dark red. May last for even up to a week or so. Cycles may vary from being monthly or may be irregular initially. This is a normal phenomena and should be treated as normal. Bleeding may be associated with pain in the lower back, abdominal pain, and even fullness of breasts. Sometimes there may be headaches or slight depression. It is a normal function of the body and should be treated as an essential part of growing up.
How should I handle a period?
Maintain your normal routine, bath, and hygiene. Use sterile napkins as far as possible. Change napkins at least every 4 to 6 hours. Avoid tampons as they can be a source of infection. Carry on with your normal routine activities as usual. In case of excessive pain, a simple painkiller or hot water bottle may provide relief. Adolescent girls require 10% more iron than boys to compensate for the loss of menstrual blood, or they will suffer from anemia. Adolescent behavior is peer pressure like socializing with opposite sex, which is either in group activity or individual pairing. Individual pairing lead to indulging in sex out of curiosity or pleasure, or activities like kissing, hugging, necking, etc. Active sexual behavior may lead to spreading of infectious diseases like hepatitis B, HIV, STDs like syphilis, gonorrhea.
Why not to indulge in sex?
Sex being a taboo topic with so much of curiosity, there is a great urge at this stage to seek sexual experiences with little or inadequate knowledge about the consequences. Sexual curiosity can be satisfied in a healthy fashion if there are people around who can easily give the required information. Unfortunately, in our society, many of the adults are unable to handle this subject with the required ease. Misinformation, exaggeration, titillation, provocation are usually what teenagers have to deal with. The sources of such may be magazines, friends, internet, movies, etc.
What are the consequences if we do indulge in sex?
It could lead to emotional, psychological, or social and physical problems. Emotional problems like guilt, anxiety, obsessions, fantasizing, lowering of school performance, and horror of parents finding out are serious consequences of it. On the other hand, physical problems like pregnancy at this stage, since the body is not geared for this physiological change, the changes of puberty are not yet complete, and pregnancy can completely damage the initial reproductive organs. Also, the hazards of termination of pregnancy in a minor. if you're less than 18 years, are severe injury, severe infections, infertility, which can be permanent or lifelong, Asherman's syndrome, that is no periods, incompetent os leading to failure of future pregnancies, chances of drug reactions and shock of surgery. If your blood group is Rh negative, you may never be able to have a healthy child later because of Rh incompatibility. In case the pregnancy occurs outside the uterus, you may end up with a catastrophe of immense pain and end up with a major surgery. Some hazards of continuing of pregnancy are that the girl does not realize she is pregnant, and sometimes it is too late to think about termination. In some cases, she does not realize that even if periods have stopped, she may be pregnant, and childbirth in these cases may lead to 2 or 3 times greater risk and injuries, stillbirths, preterm delivery, emergency cesarean, small for date babies. But this is not all. Child born in such a situation may have to be given for adoption because of obvious social pressures. This may also cause immense mental and psychological problems. This can be prevented by using condoms, failure of which is 10%, oral pills failure of which is 0.01%, or by morning after pill. Active sexual behavior is risky and should be avoided by children at this age. HIV is a major hazard of irresponsible sexual activity, and till date there is no vaccine or treatment available. The only precaution one can take is to have a safe sexual life. It involves monogamous, that is single partner sex, use of condom to prevent HIV and other STDs, testing of sexual partners for HIV beforehand. Some of the bacterial diseases which are sexually transmitted are gonorrhea, which causes soreness of genitalia, LGV, which causes urethritis, which means pain and tenderness while passing urine, anal inflammation, genital ulcers, etc. Non-gonococcal urethritis, which causes discharge from urethra, that is urinary opening. Syphilis, which causes genital ulcers, rash, etc. Chancroid, which causes soft genital ulcer or bubo. Non-specific vaginitis, leading to vaginal discharge. Some of the viral diseases which are sexually transmitted are genital herpes, which causes ulcers or vesicle or even cervical cancer. Condyloma acuminata, which causes genital warts. Some of the protozoan diseases which are sexually transmitted are trichomonal vaginitis, which causes vaginal discharge. Amoebic vaginitis, which causes vaginal ulcers. Vaginal discharge can be either normal or infectious. While normal makes you comfortably moist but does not stain your undergarments, clean, watery and sometimes whitish mucoid, it is increased during premenstrual and mid-cycle phases. Does not leave stain and is normally increased during sexual excitement. It is not smelly, nor does it cause much irritation. While in infectious cases, excessive amount of discharge cause itching, curdy white indicates fungal infection, brownish frothy may be seen in protozoan infection. Mixed infections can also occur. They may be foul smell, irritation, itching, and needs adequate and prompt treatment. If not treated adequately, can lead to further serious infections. Leukorrhea can be seen pre and post menarche. It is normal and does not require any special treatment seen normally during puberty. Handling of external genitalia by children of both sexes is termed as masturbation, sometimes even before the age of 10 years. Majority discover that manipulation of the phallus and surrounding areas gives erotic sensations, leading to orgasm. 95% of the boys masturbate in this way, and failure to do so may indicate abnormality, rigid upbringing, religious education may be causes of non-indulgence. Girls are supposed to be less inclined, but approximately 60% may indulge in masturbation. It is clitoral or vulval and rarely vaginal. It tends to disappear with advancing years, especially when a partner offers more satisfactory outlet for the sexual urge. It sometimes conveys a sense of guilt and shame, though it should not. Except for this emotional reaction, it is harmless. Many adults in later years worry over this aspect and require reassurance. Ideally, children should physically tire themselves out and mentally be busy with academics and other activities. Sex should not be too much on their minds. The other major issue of concern is molestation, rape, and incest.
What is rape?
Rape is when a man has sexual intercourse with a woman without her consent or with her consent by putting in her fear of death or hurt.
What is incest?
Incest means sexual intercourse by a man with a woman who is closely related to her by blood.
What is molestation?
Molestation means sexual harassment without one's consent. A word of caution. Girls should be at guard in situations where sometimes cousins, uncles, male help, male tutors may take advantage of them. Young boys are also very vulnerable to sodomy, which is anal intercourse by another male, or what in common term is called gay behavior. Every child has a right to protect himself or herself against such advances, and you can go to the highest authority possible with your complaint. Do not get pressurized by the person committing this act to make you either guilty or an accomplice. It is your right to be protected from any such advances or attentions which you do not seek. You must be alert to this possibility in your everyday life. Do not stay alone with a person who makes you uncomfortable by his gestures.
Who can be affected by HIV?
People who are at the risk of getting infected are drug users, recipients of blood transfusions, homosexuals, heterosexuals, prenatal. Caused by human immunodeficient virus, most common is HIV-1. It has an incubation period of 6 months to more than 10 years after the acute infection. There are various kinds of infections like acute infection, asymptomatic infection, persistent generalized lymphadenopathy, and AIDS.
Why is it rising?
It is rising because of increasingly liberal attitude towards sex, uncontrolled prostitution, increase in sexually transmitted disease, lack of sex education, low contraceptive use and high birth rate, lack of adequate knowledge of HIV infectors, and increasing drug abuse.
How do we know about its infection?
HIV has following symptoms: weight loss, chronic diarrhea, prolonged fever, persistent cough, generalized pruritus dermatitis, recurrent herpes zoster, disseminated herpes simplex. Education is empowering. It strengthens individuals, families, and communities. Because education has such a profound impact on both a child's and a society's future, these are few issues which concern a child's upbringing. Continuous awareness of the child towards these issues can only lead to the development of a healthy society. Certainly, this is not the end, but the beginning.